In the pursuit of better health, how often do you consider the potential risks that comes hand in hand with the medications we rely on? As medical science advances, we find ourselves armed with an impressive array of drugs to combat various illnesses and improve our well-being. Yet behind the promises of relief and healing lurk the shadows of potential side effects, some of which are more ominous than we might have imagined. In the United States, medications play a crucial role in treating various medical conditions and improving the quality of life for millions of people. However, like any powerful tool, medications come with risks, and some drugs have been associated with potential side effects that include an increased risk of cancer. While the benefits of these medications may outweigh the risk for many patients, it is essential to be aware of these potential side effects and make informed decisions with the guidance of healthcare professionals. In this video, we will explore the top 10 medications with side effects of causing cancer in the US, examining the available evidence and the implications for patients and healthcare providers. Disclaimer: the information provided in this video is for educational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of a qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have watched in this video. Number 10. Methotrexate. Methotrexate is a commonly prescribed medication used to treat various autoimmune diseases, such as rheumatoid arthritis, psoriasis, and certain types of cancer. However, studies have suggested that long-term use of methotrexate might increase the risk of certain cancers, including lymphoma and skin cancer. Patients taking methotrexate should be closely monitored by their healthcare providers, and the benefits and risks should be carefully assessed. Number 9. Hydrochlorothiazide, or HCTZ. Hydrochlorothiazide is a widely used diuretic medication that helps lower blood pressure. Unfortunately, research has shown that long-term use of HCTZ may be linked to an increased risk of skin cancer, especially squamous cell carcinoma. Patients on these medications should take necessary precautions to protect themselves from excessive sun exposure and undergo regular skin checks. Number 8. Hormone replacement therapy, or HRT. Hormone replacement therapy, or HRT, has been a widely utilized treatment to ease the symptoms of menopause and improve the quality of life for women experiencing this transitional phase. Menopause, a natural biological process, often brings about uncomfortable symptoms such as hot flashes, night sweats, mood swings, and vaginal dryness, among others. HRT aims to alleviate these symptoms by supplementing the body with hormones that decline during menopause, particularly estrogen and progestin. While HRT has proven to be effective in managing menopausal symptoms, it has also been the subject of intense research and scrutiny due to its potential link to certain cancers. Several studies have indicated that certain types of HRT, particularly those containing both estrogen and progestin, may carry an increased risk of breast cancer and endometrial cancer. These findings have understandably raised concerns among women and healthcare professionals alike. Number 7. Azathioprine. Azathioprine is an immunosuppressive medication prescribed to prevent organ rejection in transplant recipients and treat autoimmune diseases like inflammatory bowel disease. However, prolonged use of azathioprine has been associated with an increased risk of developing lymphoma, especially in patients with certain genetic factors. Patients on azathioprine should receive regular monitoring and discuss any concerns with their healthcare team. Number 6. Androgenic steroids. Androgenic steroids, a class of medications designed to mimic the effects of the male sex hormone testosterone, have found their way into medical practice to address various hormonal imbalances and developmental issues. From delayed puberty in adolescents to certain conditions where the body fails to produce sufficient testosterone, these steroids have proven to be valuable tools in restoring hormonal equilibrium. However, as with any potent medications, the benefits they offer are often accompanied by potential risks that cannot be ignored. Extensive research and medical studies have brought to light a concerning association between androgenic steroids and an elevated risk of liver cancer, as well as certain other malignancies. While the exact mechanisms behind this link are still being investigated, it has become clear that these medications can have far-reaching implications beyond their intended therapeutic effects. Number 5. Tamoxifen. Tamoxifen is a medication commonly prescribed to treat hormone receptor positive breast cancer. However, paradoxically, it has been associated with a slight increase in the risk of developing uterine cancer. Women on tamoxifen should undergo regular gynecological checkups to detect any potential issues early. Number 4. Tetracycline. Tetracycline antibiotics are commonly prescribed to treat bacterial infections. Nevertheless, research suggests a possible association between long-term tetracycline use and an increased risk of developing non-Hodgkin lymphoma. As with any antibiotic, tetracycline should only be used when medically necessary. Number 3. 5-fluorouracil or 5-FU. 5-fluorouracil is a chemotherapy drug used to treat various types of cancers, including breast, colon, and skin cancer. However, like many chemotherapeutic agents, 5-FU can have potential side effects, and there have been reports of it increasing the risk of secondary malignancies in some patients. Number 2. Pioglitazone. Pioglitazone is an oral medication prescribed to manage type 2 diabetes. Although effective in controlling blood sugar levels, studies have suggested that long-term use of pioglitazone may be associated with increased risk of bladder cancer. Diabetic patients taking pioglitazone should be aware of this potential risk and discuss it with their healthcare providers. Number 1. Isotretinoin. Isotretinoin, better known by its brand name Accutane, has been a game changer in the realm of dermatology, offering hope to individuals suffering from severe acne that has resisted other treatment options. This potent medication is hailed for its effectiveness in treating even the most stubborn cases, transforming lives and boosting self-confidence. However, as with any powerful tool, there are risks that demand our attention and vigilance. Recent studies and clinical observations have revealed a concerning association between isotretinoin and an increased risk of certain types of skin cancer. This revelation has sparked debates among medical professionals and raised awareness among patients who turn to this medication for relief from the burden of acne. Medications have revolutionized healthcare and saved countless lives, but they are not without risks. While the medications mentioned in this video have potential side effects related to cancer, it's important to remember that the decision to use these drugs should always be made in consultation with qualified healthcare professionals. For many patients, the benefits of these medications may outweigh the risks, and close monitoring can help detect any potential issues early. By staying informed and communicating openly with healthcare providers, patients can make well-informed decisions about their treatment plans, promoting safer and more effective medical care. For a more comprehensive understanding of this topic, please see the description box. We provide a list of the top 10 questions to ask your pharmacist when picking up your medication. This is not an all-inclusive list, and if you need more information, check out the link below. Welcome to Dr. Vivian Medications and Natural Supplements. Our channel is dedicated to providing valuable information on health and wellness that's made by a licensed professional. Times are crazy, and it's extremely important to be well-informed and taking care of yourself. If you enjoyed watching, please help us out by liking this video. In this way, we will know how well we're doing. And if you like more of these, consider subscribing and hit the bell notification to stay on top for more upcoming videos. Thanks for watching.